Kenya's antivirus lockdown is changing the ways that people consume services.
And we're seeing that in Kenya, basically because people are spending more time at home, they are spending a lot more time online than normal. We are seeing a lot of new tech-based platforms that are pushing the limits of what has been done.
No one expected such a pandemic to hit the way it did. It came as a shock to many industries.
One of the sectors turning towards web-based home service delivery is healthcare. Visiting hospitals like this one has come to be seen as a risky proposition. So companies like Tibu are turning towards technology to put patients' minds at ease.
At Tibu, we aim to make it as simple as possible for you to request a healthcare worker to your place.
So typically people think healthcare, what do they think? They think clinic or hospital. Now people don't want to go to the clinic or hospital, and we're showing them that they don't have to. Essentially, it's a two-sided marketplace where we have healthcare workers on the one app and we have clients and patients on the other. And so we connect the two, physically connect them with our kids in real times. We pretty much launched our product right more or less around the time that we had our first case of COVID in Kenya. People want us to stay out of hospitals. It's true. I've spoken to a number of physicians that work in a number of hospitals, and they're ghost towns. So now it's more convenient than ever for people to say, oh, I can get the same services as I get in a clinic, including lab works, all of it in the comfort of my own home. Well, obviously, I'm not going to go to the clinic and risk infection or what have you. So we have seen an uptick because of those reasons.
We have the blood pressure machine, the stethoscope, the pulse oximeter, the fetoscope, even as well as a weighing machine and also an otoscope for basically ear examination. So I've arrived at the patient's premises, so I'm just coming to do a quick checkup on her, look at her blood pressure, and basically in case I find anything, I'll do the necessary lab tests, or if a referral may be.
We've really modified the deployment of services in light of COVID-19, and of course we monitor our healthcare workers daily whenever they're in.
Hello. Hi, I'm Dr. You made a consult on the Tibu practitioners?
I did.
Ah, great. So can I come in?
Please, come in.
Thank you.
There's a patient assessment for COVID before we actually go to the patient's house. But as the healthcare worker, you have to make sure that you have the necessary personal protective equipment, you have to sanitize, and by the time you also go to a patient's house, you have to have the mask.
You know, there's a huge amount of medical claims fraud in Kenya. Upwards of 40% of medical claims have a fraudulent element to them.
With our patent pending kit, we keep a record of all the content that is inside the kit, and we're able to correlate that to the visits that we've had. There's a digital footprint for all the material that is used, all the tests carried out, all the requests that have been made. So beating the system is near impossible.
Depending on the healthcare profession that we're discussing, typically there's between 30 and 45% of healthcare workers that are not gainfully employed, so underemployed or unemployed. And we want to change that. We want to help absorb more healthcare workers in the system.